Thank you, Quentin. Kia ora, and welcome from the beautiful Otautahi here in Christchurch today. Really excited to be here to share with you all what we love about working here and working for you here. So, ko Karen Takuingoa, and I'd like to introduce the wonderful Manda challenger. That's Manda without an A. You need to save those for your exams. This is the amazing Carl Hazy. Nothing he can't do for you or answer for you. And then we're also joined by the most illustrious Anastasia and Luke, who will also share with you some of their experience in working here and be able to answer any questions as well along the way. So we'll kick off. Our presentation is going to start with a video that we prepared earlier, and then we'll just step through RDST's component, what the Medical Education and Training Unit can offer for you, and then Anastasia and Luke will be able to talk to you as well about working here as a junior doctor. So Quentin, when you're ready, if you could play the video, that would be great. Thanks.
Okay.
I knew I wanted to work at a larger centre because there's a lot of opportunities here to work for different specialties. There's great mentors here as well and lots of research happening if you want to get involved with that. Christchurch also has some great facilities here and great access to things like radiology, and also in terms of like teaching, where we have lots of like simulation sessions, which was really good. And then there's also like a new outpatients building as well. Yeah, I'm going to stare into the camera and be like, hi to everyone at home.
So I came over to New Zealand on my own and initially thought, oh my goodness, what have I done? I don't know anybody. And then I went down to the RDST office a week before I started work, was made to feel very welcome, got told where to find a place to live, where to go out for dinner, what different sports clubs you could join.
You know, we have the RDST and people like that who actually organised a whole week of orientation.
We had a week-long orientation where they were going through things that might be different or might be similar to what we'd have been used to at home.
When I started on the first few weeks, we had a lot of support from other PGY2 house officers.
They ran through cases, you know, you have a septic patient, what are you going to do? And just giving us helpful advice. I thought that was quite good.
So it was actually a really easy transition.
So there's a real emphasis on ongoing learning at the CDHB.
The Metu teaching sessions were really good.
Metu provides lots of teaching opportunities for PGY1s and 2s.
All of the house officers come together and we learn about a wide variety of topics from experts in the field.
And there was a really good variety of teaching sessions coming from like both medical and surgical sides, as well as having a lot of procedural teaching sessions as well.
I have found the RDST really easy to work with.
They were so helpful from day one, I think nearly a year ago now when I first applied.
They are very good at working with you and allocating leave and giving you the placements that you preference.
We always know where to go if we've got any issues with anything regarding work or just general life advice.
Spend a lot of time in that office.
We do.
A really special thing that we have in the CDHB is the CTCs, so they're the clinical nurse coordinators, and they're actually like really experienced senior nurses who do help deal with situations. They've seen a lot of it before. If you've ever got questions, they're a really great resource to go to.
The CTCs are probably one of my favourite things about the DHBs.
We love the CTCs.
They're so great. They triage all of your jobs on the on-call shifts. They're very protective over the doctors, I find.
Yeah.
So switched on and so supportive.
We have PGY2 house officers who wear snazzy checkmate lanyards, which means that they are very willing to be asked for help if you need anything.
Having worked for the NHS and the HSE, that the work-life balance is something I thought I was prepared for a difference, but I wasn't.
The vibe that the central city has and all the things that are popping up, I think it's a really great place to live long term and sort of be able to raise a family.
There's lots of places to eat out. The hills are right there, there's beaches right there.
I mean, there's a botanical gardens literally just around the corner from the hospital. Sometimes when I've had a really stressful day on oncology or something like that, I would just literally go on a half-an-hour walk in the botanical gardens.
New things are coming up all the time, like the Riverside markets.
And it's also a really great base if you're interested in the outdoors. There's so much that you can get to.
You can ski one day, you can surf the next day. There's just
so much to do.
I like lots about Christchurch, so I could rave and rant about it, but
and there's lots of things happening, so I think it's a really great place to be.
Just get on and do it. That is the best decision I've ever made.
Absolutely.
I would highly recommend working at the CDHB. It's a very friendly and supportive environment to work in. There's a wide variety of specialties to get involved in, and it's a beautiful city. So you, come to the CDHB.
That's awesome. Yeah.
Right, kia ora. My name's Amanda Challenger, so I'm the team leader of the Resident Doctor Support Team. The Resident Doctor Support Team is essentially another name for our RMO unit with the emphasis on support. So our job, Carl and I both come from that team. We're a team of 9 people whose job is to support you in everything that you do, help you with leave, help you with training related questions. Yeah. So these are some of our hospitals. So in the top left, this is our brand new acute services building. So that hosts a beautiful new ED, ICU, surgical wards, and a wonderful new theatre suite. The bottom left-hand corner is Christchurch Women's Hospital, which sits alongside that. We've got some rural hospitals. We've got Ashburn in the top middle, and we've got the new Greymouth Hospital in the top right. Also a lovely facility. And then the bottom row in the middle, we've got Burwood, which is our older person's health facility, and we also do a number of elective surgeries out there. And then bottom right, we don't have a picture because we're waiting on our new wonderful Hill Morton Hospital, which is our specialist mental health facilities. So the application process for coming to work at Canterbury District Health Board, I just want to tell you a little bit about what we're looking for. So you'll submit a cover letter, and it's really important to write why you want to come to Canterbury. So we're very supportive of getting people back to their home city. Tell us what you love about Christchurch. Tell us about your family here, your links to the region. That's going to give you a big tick. In terms of references, obviously references are always important when applying for a position. So get some great references, give us a variety of references, and obviously they need to be as most recent as possible. And the number one thing, if you want to come work for us, obviously rank us first. I like to say that we're a pretty popular DHB, so chuck us up at number 1 and you'll definitely have more of a chance of coming here next year.
Perfect. Okay, it's me, guys. Kia ora, everyone. My name's Carl. As Amanda mentioned, I'm a part of the RDST. I am lucky enough to look after the 5 coordinators within the team. And we kind of deal with the daily operations of all the rostering and everything that comes along with it. So I'm going to talk to you about a little bit of the sort of technical stuff around runs and what we can offer you in your PGY 1 and 2 years if you gain a position here with us. So you can see on the screen now there's a list of the first year runs that are available. So the majority of those are based at our main public campus. You can see there's some psychiatry there. So that's based at Hill Morton Hospital, which is only about 5 to 10 minutes drive from the public campus. And then there's also some older person's health runs in there. And they're actually based out at Burwood Hospital, which is about a 15-minute drive from the public campus. And then on the second slide here, you'll see the second year runs that are available. So a little bit more option and variety there. There's some community-based runs as well, which are a requirement for you to complete within your first 2 years. You can see there's also some options for specialties in your second year, which are 6-month positions that we offer to PGY 2s. There's pediatrics, ONG, and ED as well. Cool. So the way it works is if you do get a house officer position here at Canterbury, not long after you sign your offer letter, we will send out a survey monkey. And in that survey monkey, you'll be given a list of blocks, as you can see on the screen in front of you. So there's 13 blocks there from A through to M. And basically what you're doing is you're going to rank those blocks in order of first preference right through to your 13th preference. And this is how your first 2 years well, essentially your first year and a half will look. So you can see there's sort of 6 runs across each row. So you'll do the first 4 runs within your first year, so that'll be your first 4 quarters, and then you've got 2 runs which will be into your second year. So they don't necessarily have to occur in the order that you see them there, but you'll do them at some point throughout your PGY1 and then your PGY2 year. So here at the Canterbury District Health Board, we have a requirement that within your first 2 years, you will complete 2 medical, 2 surgical, a community-based, and a psychiatry run. So that basically takes up 6 quarters, and that leaves 2 quarters for you in your second year to essentially preference what you would like to do based on your career. And obviously, there's also the option there for the specialty runs as well, for the 6-month runs in your second year. So into the next slide, you'll see just a bit of an example of what I was talking about. So if you were given block A, then you would do general medicine quarter 1, general surgery, cardio, and OPH. And then in PGY2, you'd have your psychiatry and then a surgical relief run. And then at the end of your first year, you'll get another Survey Monkey where you get to preference what you want to do for those remaining 2 quarters in your second year. Yeah, I think that pretty much covers it for me.
Awesome. Karen, over to you.
Thank you, Amanda. Thank you, Carl. So I am one of 2 that work in the Medical Education and Training Unit, and we also have a team administrator, and our clinical director is Dr. John Thwaites. And we, as our small team, but as you can see on the screen there, we're responsible for your ongoing education, training, supervision. We make sure that you're doing everything that the Medical Council require of you. So that's us in a nutshell. With regards to supervision, we will appoint you an educational supervisor. There you can see it's PES, which is our Medical Council refers to them. It's a pre-vocational educational supervisor. And you will have that supervisor with you for your first 2 years. When you're in a run, they will appoint you a clinical supervisor with whom you will meet with at least 3 times during that run. Your educational supervisor is there, as I say, for your first 2 years, and they can be approached at any time for any reason. Think of them as a mentor as well. And they will have a lot to do with your EPORT, as will your clinical supervisor. And if you don't know what EPORT is yet, you soon will find out. It's your electronic portfolio where you can document all your progression through your first 2 years. I'm going to give you a quick snapshot about what teaching we cover and the facilities that we have to do all the teaching. Our teaching program occurs every Wednesday afternoon at 3:30 till 5, and it's predominantly aimed towards our first year house officers, but any RMO is welcome to attend, and our second year house officer teaching Thursday lunchtimes. So as I say, a snapshot of the teaching program, we cover all the ologies. We've got cardiology, hematology, radiology, oncology, and we get senior medical officers down that will take you through that. A lot of it is didactic. We talk about the head issues, psychiatry, neuro, epilepsy, delirium, sorbets. So we do a lot of teaching on analgesia prescribing, gout, acute abdo, the leaks, sort of looking at fluid charting, Ds and Bs, GI bleeds, vascular disease, and other stuff, ENT, palliative care, infectious diseases, oral health, as an example. Plus, scenario training. We're trying to incorporate more and more of this into our teaching program. So we've introduced what we call a 20-minute rapid fire scenario training, and we'll come across for an afternoon and we'll run through 4 20-minute scenarios, small groups, and you're in and out, and each scenario is facilitated. Sick and deteriorating patient scenarios we run very early on into your first year. If it's not during your orientation week, it is within the week or second week post orientation. We are new this year, or sort of late last year. We're looking at interprofessional scenarios, site-specific scenario training at our Hillmorton and Burwood hospitals. So it's kind of a part of a mini orientation, because each different hospital is a different focus. So Burwood has older person's health, for example. Then we will run an older person's health scenario alongside the nursing team. So it's a way of learning the nuances about how Burwood runs as a hospital, different patient care protocols, and getting to meet the rest of the team that you will be working with, especially in an out of hours situation. And also, we look very closely at the mahi model, which you would have experienced as medical students. And so it's an extension of what you have done in med school. And that is facilitated alongside the wonderful team at Otago Med School, the mahi team there. And that's a mixture of online learning modules as well as face-to-face sessions and scenario training with actors again. And it's proving really popular, and we're getting some great buy-in, and you also come away with an extra qualification once completed that course. Practical skill sessions, so we're looking at nasogastric tube placement. That's an interprofessional approach. We get the radiologists, dietitians, pharmacists along, for example, and the nurse specialist. Suturing and knot tying, airway management, and ultrasound guided IV placements, and lumbar puncture. And so just an example of some of the practical skill sessions we run. And then on top of that, we also have workshops. We do quite a bit around wellbeing and resilience. We are also doing pharmacy workshops. So we put you into small teams and you'll work with a pharmacist. And the idea of that is we have a clinical focus on certain medication and prescribing. And when you're out on the wards, you'll be working with these pharmacists. So the pharmacists we want you to see as more of a coach. And as I say, once again, it's just a really great way of intercollaboration and good working relationship. And we do a bit of work around conflict management and serious illness conversation guide as well, sort of how to deliver bad news. Me too, alongside the RDST unit, run your clinical orientation. So once you start here, it's 4-day orientation. Basically, we'll cover off computer application programs, CTCs and handovers. We get the house officers back to run sessions around the survival guide, or house officer hacks as we call it. Another focus on discharge summaries. We also offer an expo where we get a whole lot of other services from within the hospital, just to meet you all and let you know about what they have to offer and how they're there to benefit you and ultimately your patient. As mentioned in the video, we have a Checkmate mentor scheme, and they're visible by the black and white checkered lanyards. RMOs volunteer to be a mentor, and it's just someone you can always approach that will never be too busy to stop and answer your question or help put you in the right direction. And we have about 80 checkmates currently through the hospital. We also have an RMO training committee, which you're welcome to join. It's just a great way of you being the eyes and ears on the ground for us, so that we can make any improvements to your training and development.
So my name's Luke. I'm one of the PGY2 second year house officers here at DHB, Canterbury DHB. My slides up first. Yeah, very good. So I thought I'd just talk a bit to start off just about the Christchurch experience, what it's like to work here at the DHB. So I found it to be quite a friendly hospital. You know, everyone's always happy to stop, answer your questions. As Karen mentioned, we do have the Checkmate second year house officers when you first start. Particularly on the duty shifts, you're quite well supported through the first few weeks. We actually have a couple of extra second year or third year house officers who float around and are available if you're a bit unsure in your starting weeks. We also have our excellent clinical team coordinators, or our very experienced nursing staff who take all the calls from the ward nurses and help triage the tasks that come through on our electronic Cortex system, which really smooths out the workflow a lot through the duty shifts. So you can see the most unwell patients first, and then get on to the less important charting paracetamol, things like that as you can. To help you along with that, we have a whole lot of good electronic tools and resources. So one thing we have that's a wee bit different at the CDHB is a lot of our notes are based off iPads, so on the Cortex application. And that's really valuable because it allows you to carry around all your patients' notes from all the wards in the hospital in your hand, essentially. So if you're going to a different ward in a duty shift, you can read through that patient's background, admission note, get a really good handle on their problem before you see somebody who's acutely unwell. Similarly, on ward rounds, it's a lot easier because you have all your lab results, your imaging, your medications, and all the past notes available right in your hand. Say if the surgeon wants to see the blood results from 3 days ago, you got them. No need to spend hours prepping beforehand. We've also got our excellent hospital health pathways. I think Auckland DHB has a similar system, and some does as well, very good, which basically just tells you what to do for presenting problems. So somebody comes in with a myocardial infarct, tells you what to do. The pink book's all about bugs and drugs, so bacteria, antibiotics, all that sort of thing. Otherwise, if you're looking to progress in your career, say you're looking to maybe go down a surgical pathway, you want to sit your Part 1 surgical exam, a very useful resource is that we have a medical library on campus that's associated with the Otago University. And as Karen mentioned, we also have the Metu teaching program to carry you through the first couple of years. The other thing I just wanted to point out is that Christchurch Public Hospital, it's quite a busy, dynamic hospital. We commonly have 400, 500 inpatients. Busy teams, particularly general medicine, general surgery. So if you want the busy, big hospital experience, it's a good place to come. Excellent, thanks. So I'll just sort of quickly run you through what I usually do. So sort of arrive 10 to 8 in the morning, log into Cortex, log into the computer system, read up on any of my unwell patients, I guess, from overnight, see how they've done, draft the ward round notes, put in observations, lab results, stuff like that. Then we round, which is usually with the registrar SMO. As you get into second year, and if the boss and reg have clinics, things like that, they might actually let you round on some of the easier patients by yourself, which is a good chance to come up with plans, that sort of thing, working towards becoming a registrar. After you've done your round, then it's time for jobs. Things like radiology requests and booking investigations, you want to get those done first, because those are things that that service has to triage before they get done. Then obviously discuss consults, referrals to other medical services, and then discharges as you can. After lunch, I usually chase more jobs, prep discharges, and then in the afternoon before you go, it's really important that you hand over any outstanding lab results, unwell patients who might need review, and any other bits and pieces that might need to be chased up overnight. The other reason I love Canterbury is because of the work-life balance. If you're into the outdoors, it's probably one of the best places in the country to come. I'm a skier, I'm a tramper. I've got out heaps of times, Arthur's Pass, Lewis Pass, West Coast, you name it. Got an annual ski pass to Mount Hutt. It's a great ski field. It's an 1.5 hour drive from the city, and it's one of the best ski fields in the country. So if you're into skiing, you can't really go wrong. We've also got a good 6-7 wee club fields, a wee bit further into Arthur's Pass and up by Hannah Springs and that. And if you enjoy surfing and mountain biking, there's plenty of opportunities for those on the peninsula and a bit further afield as well. And same goes to the city life too. If you like the city, we've got plenty of new cafes, restaurants. There's always new ones popping up. I've been here for coming up 5 years now. Did my clinical years at med school here too, and it's been amazing to see how how the city's rebuilt over that time period. It's just always getting better. And when the travel bubbles eventually open up, we do have one of the best international airports in the country too. It's an easy sort of 10-15 minutes drive from the hospital. So it's quite handy to get out of the country, around the country. As far as starting off as a house officer goes, there's some really good documents available on the Metu website. Have a read through what the run entails, top tips, that sort of thing. There's also some useful documents on ePort to help direct your learning within those runs. When you're working, of course, if you're ever unsure, ask a more senior house officer, RMO, or ask your registrar or the SMO. Obviously, it's relevant on duty shifts because you don't want to be getting too out of your depth and making decisions that could potentially be unsafe. Yeah, thanks guys. That's about all I want to say. And feel free to ask questions later.
Hey guys, I'm Anastasia. I'm a PGY1, so I have not been here as long as Luke, although he's pretty much covered everything. I also didn't train here, so I trained in Dunedin and just moved up here for my house officer years. So I've only been here about 6 months. But I have to say it was an amazing move. I've loved working here so far. The hospital is really supportive and everyone has been super nice. The RDST and Me Too unit here is amazing. So yeah. Oh, and I'm also your NZMA PGY1 rep if you need anything, questions about applying for ACE and moving forward into your first house officer job. So yeah, that's about all from me. If you guys have any questions, feel free to ask away.
When you start working nights in PGY1, Cal?
Oh, yeah, sure. So, well, you
guys
yeah. So basically, if you do general medicine within your first quarter, then you can commence nights from quarter 2. If you don't do general medicine within your first quarter, then you'll start nights in quarter 3. So essentially after 6 months.
Great, thanks, Carl. What do we got here? Can you change your options for PGY2, quarter 3 and 4 once you pick them, or are they set in stone?
Sure. So the first 2 quarters in PGY2 that are a part of your initial block, so they're there, that's somewhere within that year. As I said, it's usually around September of your PGY1 year, you'll be sent another survey monkey, and that's essentially for you to preference what you want to do for the other 2 remaining quarters. So once we then release the allocations for your PGY2 year, it is, that's the formal publishing. You can swap runs after that, but you will need to have that approved by your educational supervisor and link in with them. And then we just check some things like leave and all that sort of stuff if you're going to be swapping runs at last minute. But as I say, as long as you meet the 2 medical, 2 surgical, 1 community and 1 psychiatry, the remaining time is really free for you to preference what you'd like to do.
Cool, thanks, Carl. The next question we've got about is putting the slide up about what we want to see in the application. Quinton, will that be going out to everybody? Will they get a copy of our PowerPoint? Or?
So we'll upload a copy of the PowerPoint at a later date, and the video will go up edited towards the end of the week this week. So they'll have access to that information in another 7 days' time, hopefully.
Great. So that I can run through those things again though. So it's your cover letter, being really clear why you want to come to Canterbury. Like I said, we get a lot of people who preference Canterbury High. So it's important that you put your best foot forward and tell us why we're so attractive. The other things are obviously the references. They play a huge part. So that's really important for us to understand your professionalism and how you've done through your clinical time. So those are the 2 main things. I see there's another couple of questions about applications. So joint applications. Karen, do you know anything about? I don't think we had any last year. I know that some people put, say their partner wants to come to Christchurch as well, they'll write in their cover letter that they both know each other, and we do consider that. I did get a question the other day about job shares. So you can put that in your cover letter as well. Like I said, we're pretty supportive DHB. We don't have a lot of job shares, but we are moving to try and bring some more in. So just put everything you want to put like that into your cover letter, and we'll consider that. Another question about the application. So how many Auckland grads do you employ? It seems like most are Otago grads. I'm not sure if that's because a lot of Otago who want to come to Canterbury. We don't have a preference out of Otago and Auckland. Everybody's treated equally when they apply. The weighting is based on, like I said, the references, and then obviously we try and preference people that want to come to Canterbury. If you're doing your clinical years currently in Christchurch, would you still recommend getting in touch with the RDS team and introducing yourself? I mean, we've got open door policy. Our office is always open. RDS team need to share an office, so you're welcome to pop in and say hello. Again, we don't like to give anybody preferential treatment, so I do know last year we did give everyone who did their TR year at Christchurch did get an extra point in terms of their application, but you're welcome. We've had a lot of people that have been down on holidays in Christchurch, so they've popped in to say hello as well. So we're very open to that. The next question, what opportunities do you have for community runs such as GP? So at the minute we've got 2 runs a year, so that's enough for 8 individuals to go out into the community. We are looking and really hoping to extend that, and we've got a new Pacifica GP just behind our outpatients clinic, which we're trying to extend an extra 2 runs in the coming years.
Can I just add to that?
Oh, sorry.
So with the community-based attachments, which is how we refer to them, we have quite a list of different GP surgeries that we've approached, and they're more than happy to supervise and facilitate second-year house officer working within their practice. As Amanda's mentioned, we're also about to launch E2 Pacifica, which is another great opportunity. And thinking outside the box a bit, we also have a run based out at Burnham Army Camp. And so how it works is we present you the list and you choose where you'd like to go. We do, and if it's available at the time, which it pretty much is, then you have the choice of the GP surgery or the community run that you'd like to go on during that time.
And if I can just add to that, I think we have almost 13 community-based runs. So although GP is an option, we do have other ones. So within psychiatry, our crisis runs are also classed as community. We also have an OPH community run, which is based out obviously in the community in relation to older persons' health. We also have runs in second year on the West Coast as well. So even though they are a separate DHB, you are, as an employee of the CDHB, able to rotate to the West Coast for a quarter as well as a second year.
And that's supported with accommodation as well.
Yeah, yeah. And then we also, because Ashburton Hospital falls within the CDHB, so I believe 5 of our Ashburton house officer positions are also classed as community runs. So there's quite a good option.
Cool, thanks guys. The next one is how many positions are there for PGY1s at CDHB for 2022? So there is around 50. That number's yet to be finalised. So hopefully we'll know that in the coming weeks. The next question, if you are unsuccessful becoming PGY1 in Christchurch, are you able to apply for PGY2 after a year at a different DHB? Absolutely. I will be honest, there's not a huge amount of positions. We don't see a lot of movement within our PGY1 year. So normally they'll carry on and complete PGY1 and 2 here. But I think we employed 3 last year. So you're encouraged to, and that's a really good time when you should come in and talk to us. Or if you're down for a holiday in Christchurch, pop in, make yourself known. Are you face-to-face introductions prior to applying at Korero? Yes, I think I answered this one before. Again, you're welcome to pop in. We understand a lot of people can't physically come into the department, so we don't want to give anybody preferential treatment. So you are welcome to come in and we can answer questions, but we don't write your name down and put you to the top of any list at all. Will we be interviewing applicants? No, we do not do interviews. I don't know if we've ever done interviews. No,
it's just a numbers and a time and a resource issue, really.
Yeah, but when you start here, you do get a tour of the hospital and a good orientation. So that's part of the question there. Will the data regarding the number of first preference applications for CDHB in 2020 be available before applications are due?
That's a nice question.
I don't know how they, well, last year, so I applied last year, and what we did is the Auckland Medical School and Otago Medical School students got together on a Facebook group and made a table that everyone rated their #1 preference in. And of course, it relies on everybody honestly putting in their #1 preference for where they want to go, but it gave everybody a good idea of how many people were applying for which DHBs as a priority. So, I mean, you could look into your own group for setting something like that up if you wanted to get a rough idea about who is wanting to go where.
And I'll just add up to that nationwide, the number of applicants matched to their first employer preferences is 86.7%, and that doesn't move too much around the country at all with regards to the averages year on year. So it's really important that your first employer preference, that you make a good consideration into what that is as well.
Cool, thank you. So the next question, how many international medical graduates do you employ, e.g. Australian graduates? So we have a lot of IMGs come in post PGY1 or PGY2. A lot of our PGY3 plus positions are RMOs from the UK. When you apply for PGY3 plus positions and registrar positions, all Australians and New Zealanders we treat equal. So everybody's considered at the same level. PGY1, do you know how many Australians we take?
Oh, it's very rare.
Yeah. Yeah, but certainly past that PGY3 plus and registrar level, we treat all Australians and New Zealanders as equals. And they're always given the first opportunity for a registrar or senior house officer position at Canterbury. And the last question we've got there is about the interviews. So again, no, we do not do interviews. The sheer volume, we're unable to. Is there any disadvantage for late starters when applying? I don't think we put any disadvantage on late starters. Obviously, it's great if everybody can start on time because it leaves us no gaps. But sometimes we have PGY1s who have got an extra run to complete the following year. So it all normally works out quite well with sheer volume that we have going through.
If you're a late starter, just let us know why.
Yeah, yeah.
And then we can, you know, we can sort the runs out and get, if you need extra support, we can put support in place.
Great, thanks, Karen. Oh, more questions. Sorry, not sure if I've heard this right, but if you did mention this, you'll be giving extra point to TIs. We've done the TI year in CDHB, as you mentioned, was done last year. That I'm pretty sure we do preference TIs that have been here for their TI year. I'm not sure if it's an extra point though. I can seek clarification and see if we could send that out on that one. Clinton, are we able to do that if we find the actual answer for that? Normally the preferencing for PGY1s is done by our educational supervisors, so it's not done by RDST and METU. So I'd need to just check with them.
Yeah, it wouldn't be something that I would communicate. You would need to communicate that through student reps, for example.
Okay, yeah. Yeah, that's fine. And we might put it on our careers website as well. Is it true you need to apply for leave when you get your contract? How do you want to take this one?
Oh, you don't have to, but we definitely say get in early. Yeah, absolutely. Essentially, as soon as you sign on the dotted line, you can apply for leave. We certainly do take in leave requests prior to run allocations being published, and then when the allocations are published, we will process them in the order in which they were received. So I guess the moral of the story is the more organised you are, the more likely you are to have the leave approved.
Thanks, Carl. Do you mind CV cover letters 2 pages long, or do you prefer 1? So as somebody that looks through a lot of CVs and a lot of cover letters, the more condensed you have them, definitely. I mean, we don't have the time to read every single cover letter in full, so keep it concise, get to the point, tell us the real things that you think we want to hear, such as why you want to come to Canterbury, and anything unique that you might be able to bring to the team. Who is the best to address a cover letter to? That's a good question. You can address it to Canterbury District House Potential. I'm just trying to think who's the best person there.
Yeah, I'm sure it's not a mind to who it makes sense.
Yeah. To be honest, we wouldn't. If somebody doesn't know who's going to read the cover letter, we're not going to hold that against you.
We don't even know.
Yeah. So that's just to whom it may concern, or to Canterbury DHB or the RDST, METU, choose anyone, any of us, maybe not Luke, Anastasia.
I'm not going
to. Question to PGY1s and 2s, how much time are you able to spend outside of work?
So usually you do 1 long day a week, and usually about 1 in 4 weekends or thereabouts.
1 in 6.
1 and 6, yeah. And the odd week and nights once you get past your first 6 or so months. And beyond that, your time is really yours to use as you please.
Most afternoons and most weekends.
Yep.
I would say.
Yeah.
Good answer. Next question, do you want us to write down which runs we've done on our CV, even though they're more or less the same as other medical students? I can't see any harm in writing those down. Again, it's just looking at the length. You know, if you send in like a 4-page cover letter and CV, it's a lot to read. Chances are we're not going to be able to read the entire thing. So just stick to the points that you think will really matter. I don't think that will carry a huge amount of weight of what runs you've done.
But it is on the ACE CV template,
Okay.
I believe, to put your runs down.
Certainly if you're applying for a PGY2 position, if you've done your PGY1 run at another DHB, putting down your runs is, we absolutely need to know what you've done in order to figure out if we can tick all the boxes that you require to come to Canterbury. Follow-up question. So the question is, do you usually finish work on time?
So far, 90% of the time I will finish on time. So that means finishing at 4 and actually leaving the hospital around 4 o'clock. And 90% of the time I will leave on time.
I'll say it very much depends on how busy your team is. If you say you're on a general medical team and you're on a post-take day, chances are you'll probably be a wee bit late. But as you get towards the end of that cycle, chances are you'll be able to leave on time. So it swings and roundabouts, comes and goes.
And your run category reflects that. That's so right. That's, you know, if you work in those longer hours, you're going to be paid more. I just found Anastasia wandering the halls with nothing to do before. So that was about 3:30.
Okay, so I'm on take today, so I'll be busy tomorrow.
Does CDHB typically employ international students who are target graduates as PGY1?
It's not overly common, I don't believe. Just because obviously there's so many that are in classes 1 and 2, I think.
Don't want to I don't think we.
I mean, we would never say we never would, but certainly in the past, I don't believe we have.
From my experience, we'd normally see those at like PGY3 plus again or PGY2.
New Zealand grads take priority, and when we have limited spaces to fill as it is, we never have less apply than positions we have. So it just comes down to a numbers game.
Yeah, great. Yeah. Based off previous questions, do you usually work 8 to 4 on an average day?
So depending on your run, again. So like my run now, I'm on cardiology, so that's an 8 to 4. But I've previously been on plastics, and so you'd expected to be there by 7:30 in the morning. So it's definitely like each run is different and each team you're on is different. But on average, an 8 to 4 is what most runs on an average day is based on.
And again, reflected in your category.
Yeah, I think on the category front, so in PGY 1 and 2 runs, we only have about one run, which is our psychiatry acute teams, which will be on a category D or E, which I think is the 40 hours per week with no out of hours involved. Is it F, is it? Sorry, which is 40. Okay, yeah. So okay, got you. But the majority of our runs for PGY 1 and 2 would be based around the C or B categories, which are sitting, probably around an average of, you're getting paid for 50 to 60 hours per week, which is inclusive of the out of hours duties that you're working as well. Yeah.
Right, thanks. Next question, what weight do research prizes grades have in placement in CDHB? So it is part of it. Part of what we receive from ACE has those components in there. We do place weight on it, but again, those references are probably, they've got a lot more weight, those references. So they're the most important thing to us. Yeah. Oh, another one. If you're not a Christchurch TI and doing a CDHB elective, will this be of greater value than a core placement reference from a different DHB? Sorry, I'm just trying to understand the question. So all of the references are treated equally. So I think that's what you're potentially asking. It doesn't matter if your reference is from a CDHB, if it's a CDHB reference, or if it's from somewhere else. We don't drill down into that level of detail. As long as you've got a good reference, then that's going to score you some good points. Does it matter if you've done research, studentship, but do not have not published your name? I'm not actually sure about that. Quentin, do you know?
We won't score applicants' presentations, research that haven't yet been published. So I'm aware that there's a couple of publications that are coming out due, I think, the first or second week of July or late July. Those I know about, and I've been in touch with those organisations. They'll send me those lists of names, but if they haven't been published without your name, then you can't get credit for it as part of our process. But it may be helpful for you to actually attach that in your additional academic information, so that the employers can view that if they wish, but you won't be scored for it if it's not published in your name.
Oh, another one. If you're late start, is it possible to start halfway through the first quarter? Now, I understand that would mean you've not completed the full run. So you wouldn't pass that run, is that correct? Because you won't have got the 10 weeks. So in each quarter, you need to complete 10 out of the 13 weeks. Otherwise, you wouldn't have started you wouldn't have passed that run. So would we normally wait till the next quarter and start on the start of a new run?
Yeah. So Amanda's right. You need to do a minimum of 10 weeks out of each run. That's a minimum. If you don't meet that time requirement, then you will just repeat a run. So if you wanted to, if the opportunity was for you to start partway through the run, then it wouldn't count. So you would still, so when everyone's starting the second quarter, it would be classed as your first quarter.
You could start 3 weeks late. Yeah. That would be it. But then you'd have to complete those 10 weeks.
You'd be working, you'd be paid. You'd just do an extra quarter to everyone else, just purely on time.
Yeah.
That's a good question.
To count publication for points, do we just include them in our CV? Then will you search them up? Quentin, is that?
Sorry, what's the question?
To count publications for points, do we just include them on the CV and then you will search them up? That's a no.
No. Again, it's going through the application. You need to provide evidence of your publications, your presentations, your scholarships, any prizes and awards that you like, and you need to upload them into the particular spot so that we can verify them.
I think as you go through the ACE application process, every step along the way gives you opportunities to upload the different things, and it will tell you where you need to upload your prizes and your publications, your research, your CV. So you won't miss those things. As you complete it, there will be pages that tell you when to upload those different things and all of the requirements to meet that.
Great.
Amanda, Anastasia, Karen, Luke, and Carl, who's probably lurking around in the background there. Tēnā pai te mahi, and thank you for your korero. It's been a very good presentation from both our DHB and PGY1 representatives, and some really good questions in the Q&A section this time around as well. So if there are any additional questions that any of you have in TI land out for our employers, feel free to submit those questions via email to CDHB. Their information is available on the employer information page. Perhaps if you wanted to reach out to the student reps, ask them some questions, I'm happy to forward them through to them if you wanted to send those through to me as well. Yeah, really thank you very much for your time, Amanda, and your team. It's been a great presentation today. Thank you.
Yeah, thank you everybody for joining. I hope we've answered the questions well and hope we've given you a bit of insight about what life will be like here at Canterbury DHB. Again, get in touch with us if you've got any more questions, pop in and say hi. We look forward to hopefully seeing some of you next year.
Best of luck with the rest of your year and take care out there.